Welcome to Goal Getter, the AAP Physiotherapy podcast. My name is Jen Panteluk, and I'm the CEO of the Alberta Association of Physiotherapy. This show explores the power of physiotherapy, helping individuals move, heal, and thrive. Let's get moving. I'm really excited to invite our next guest to the show today. As a mom of 2 kids, I think this is such a relevant topic for every woman out there. So it's my absolute pleasure to welcome Dr. Nadia Keshwani to the show today to talk about pelvic floor. Welcome, Nadia.
Thank you. Thanks for having me.
Let's go back to the early days. How did you get involved? I know this isn't typically a mainstream of physiotherapy that everyone thinks about when they enter the profession.
Yeah, definitely. It wasn't for me either. In fact, going into physio, I had no idea that this field existed, like many women. So it was only actually in my physio degree that I got exposed to pelvic floor physio or pelvic health physio, we often call it. And so I was really lucky because I did my physio degree at McGill. And nowadays, there's really only 2 main groups that actually teach the certification courses for pelvic health. And one of those was a graduate of McGill. So I was really lucky in that she was the one who actually was coming in and taught a whole bunch of pelvic floor content to us as part of the physio degree. So during that time, I was really interested in it. I thought, like, this is a really cool area to get into. It's really helping a niche of the population and women specifically, but it wasn't really what I thought that I would be doing. So at that point, I finished my physio degree and I was also really interested in research. So I ended up finding someone, a prof at Queen's at that time, that was involved in pelvic floor research. So she was a physiotherapist herself by training. So I ended up doing a research-based master's in pelvic floor physio under her. And then throughout that process, got all my certifications and realized that this is a really fun, cool, really helpful area that made me really excited to kind of continue to get into it. So after that, I ended up liking it so much, I returned to clinical practice and I ended up later on going and pursuing a PhD as well in the area. So it's an area that I'm really passionate about.
That's amazing. And I think it's an area that is just not talked about enough, really, with women and different healthcare providers. So maybe let's just set the stage. People hear pelvic health all the time, but I don't know if they fully understand what it is. Can you start maybe by explaining what the pelvic floor does and why it's so important?
So the pelvic floor muscles, they sling from the pubic bone in the front to the tailbone in the back. So they're a very large structure. And if you sit up nice and tall and you just kind of see where your 2 sit bones are, and you can kind of sway side to side to kind of feel that soft space in the middle is where your pelvic floor muscles are located. So they actually help form and surround the vaginal opening, the anal opening, and the urethral opening in women. So because of their very unique location, they're really, really important in terms of good bladder health, good bowel health, and also good sexual health as well. They also help support the pelvic organs. So they're called the pelvic floor muscles very aptly because they do actually help form the floor of the pelvis. And they're also part of our core. So they have quite a few really, really important functions for everyone, but for women in particular.
So I know when you and I were having some pre-conversations, we had a little bit of a conversation around what's not normal. So what are some of the most common symptoms that a woman might experience that could indicate she has a pelvic floor issue?
So, for instance, if a woman has any urine leakage, specifically things like urine leakage with coughing or sneezing or laughing, that's not normal. Also, in the same line, like any leakage with exercise, like running, jumping, weights, any of that kind of thing, also not normal. Anything to do with a sensation of urgency, the sensation you have to pee and it has to be right now and there's no holding it. Also, we should be able to hold it if we need to, so that's not normal. Sensations of heaviness or bulging in the bottom area, like things are going to fall out, also not normal. Any pelvic pain related to exercise or intercourse, discomfort during or after sex or intercourse, also not normal. So those are kind of some of the common symptoms that are not actually normal.
So you touched on kind of a bit of that leakage. And I remember when I was pregnant with my first daughter, a friend of mine said, I can't run anymore. Every time I go run, I start to pee. And she equated that to having kids. And so there seems to be a little bit of a belief or a misconception out there that bladder leakage is just a normal part of aging or of having kids. Can you explain a little bit about why that's a myth and maybe how physiotherapy can help there?
Yeah, so I think one of the reasons, especially like if we touch upon the two areas in like that you talked about in life, so postpartum after having a baby, and then also as you're aging, so probably postmenopausal. So postpartum first. So research shows that about 30% of women will experience bladder leakage in the first year of postpartum. So within the first year of having a kid, 1 in 3 roughly women are going to be complaining and experiencing bladder leakage. And that's a very conservative estimate. So that means if you're in a mom group and maybe you're talking to your other friends, probably some of them are also going to have leakage too. So I think the fact that it's also so prevalent just allows women to kind of think, okay, well, you have it too, so it must be normal. Like this is a part of having kids. So I think part of it is that prevalence, right? And then for the aging component of things, similar concept. So research shows that about 25% of women who are postmenopausal also are complaining of bladder leakage. And again, that's a more conservative estimate. The actual value is probably much higher. So I think the same thing, the fact that it's so prevalent. Plus, then we are bombarded by all these incontinence products like pads you see in the grocery store or anywhere else. So I think because of that, women they can't help but believe that those bladder leakage and other symptoms are normal.
And no one really necessarily tells them that this is normal. Or do you find a lot of women also are too afraid maybe to speak up about it when they're visiting other healthcare practitioners because they have that stigma, oh, this is normal, this is just what happens?
Yeah, it's kind of an area that I think women still don't necessarily feel comfortable to speak up about. And there's research showing that also, like in relation to like other healthcare professionals, family doctors, women who are experiencing pelvic floor symptoms, and any of the symptoms that we kind of touched upon earlier, they much prefer, again, according to research, for their healthcare provider to bring it up to them and ask if they're having the complaints. So it just takes away the embarrassment in part because you're not the one that's bringing it up.
Like, I just think back to my experience and my journey again with both of my children, and no one ever asked those questions postpartum when I went in. It was more, right? Like, it was, you were in and out, you're more looking at the baby, making sure they were fine, but not a lot of focus in on the mom. And do you think that that's something that we need to almost shift as society, is asking better questions when women are coming into a setting after they've had a baby?
I think asking better questions or even just having the referral in place, I think a lot has changed um, with our healthcare system. And nowadays, what I hear from, so a lot of times to backtrack, I'm seeing, not always, but I often will see a woman in pregnancy and they follow up with me postpartum. And a lot of times, when they're coming in for their follow up with me postpartum, even if that's 6 or 8 weeks, they may have not even had their OB-GYN follow up at that point. And if they have, I think the experience is very similar to yours, where, excuse me, a lot of women are not even necessarily like the focus is like a quick, like, okay, are you done bleeding? Are you like, is everything good there? Do you feel fine? And that's kind of like all there is. So it's typically one postpartum follow up, and it's usually only talking and very briefly at that. So I think in terms of changes, again, we have limitations with our healthcare system, but I would love to see because oftentimes I'm the one who's doing the internal exam and an internal check within my scope postpartum versus an OB-GYN. So I would just love to see more automatic referrals where, you're in the constraint of an OB-GYN office, sure, maybe ask some questions, maybe have a pamphlet and say, hey, you should maybe consider going to see a pelvic floor physio.
Right. And directing them to get that right care that they may need.
Yes.
So you touched on seeing women during their pregnancy. What are some of the benefits to seek pelvic health help during pregnancy, to help either along the journey while you're pregnant or to help set you up for success postpartum?
So, in terms of pregnancy, there's a lot of potential benefit to seeing a pelvic health or pelvic floor physiotherapist during that time. So, for instance, pelvic girdle pain in pregnancy, having pain in the low back, the pubic bone, the groin, any of that kind of region is actually really common in pregnancy. It happens in about 1 in 2 women, so 50% of women. And if you've had it before in your first pregnancy, you're even more likely to have it again for your second or subsequent pregnancies. So, even just that, a lot of women I hear they've been told that by other healthcare providers that that's just a part of pregnancy. There's nothing to do about that. But in reality, if you are experiencing pelvic pain in pregnancy, and again, you are pregnant, there's still some things to do about it if you consult a healthcare provider, a physiotherapist in particular. So that's kind of one component that can be really helpful. The other component would be just simply getting some really good tips for labor and birth. So typically, that would include things like perineal stretching, some education on how to push, different birthing positions that may or may not be, better or worse for you depending on the situation. And all that in mind to decrease the risk of a higher degree of perineal tearing, which can lead to some other issues. It also typically includes like some component of pelvic floor muscle training. So 50% of women in their pregnancies end up complaining about bladder leakage with coughing or sneezing or laughing. So that can actually get treated in pregnancy, not just postpartum, to just reduce the severity of it. And actually learning a little bit about how to connect with the pelvic floor muscles can be really helpful with the birth process itself, especially if a vaginal birth is planned too.
So it sounds like everyone should see a pelvic health physiotherapist when they're pregnant just to help better set them up for success.
Ideally, there's lots to do.
Yeah, there is. And I think, again, it's just one of those topics in healthcare that's not really addressed a lot, or many women, I don't know, go down the dangerous Google rabbit hole. And to your point, oh, everyone else, this is happening to everyone else. This is normal. I don't need to consult any other professionals on my journey. What are some of the lesser known signs of pelvic floor dysfunction that women might not realize are related to it?
So things like tailbone pain, for instance, that's a pretty common one, if not soon after having a baby, even later on in life. And the pelvic floor muscles actually attach right onto the tailbone. So that in itself, there's a physiological reason for or a connection there between the pelvic floor and the tailbone. So like pain with sitting, for instance, is a really common one that can be related to the pelvic floor muscles. Even things like hip and back pain can also be related. So the pelvic floor muscles are part of our core. So we want them to be functioning optimally to be able to help support our spine and support the rest of our body. So if they're not functioning optimally, that can actually lead to things like low back and hip pain as well. And even like along with that, the pelvic floor muscles, they actually have the ability to radiate pain elsewhere. So that includes places like the low belly, the hip, the low back, the thighs, inner thighs, back of the thigh, the bum. So especially if like someone is experiencing symptoms in those areas, any of those areas, and it's not really resolving as expected with other treatment, then it can really be indicative of pelvic floor issue, especially if that woman's also experiencing any of those other symptoms too, a little bit of leakage or a little bit of pee escapes when she coughs or sneezes. And then combined with those other symptoms can really be indicative of a pelvic floor problem.
So lower back pain, that's, I mean, a huge challenge for a lot of individuals, or a lot of reasons why someone may enter the healthcare system. Is pelvic floor ever considered early on when trying to find the root cause of lower back pain, or do you think that kind of happens further down the road when nothing else is working?
Yeah, I think it generally happens further down the road. There's so many mechanical and other reasons why someone might experience back pain, and a relation to the pelvic floor muscles is just one possibility. So I think like generally a full exam is done for the whole body, and sure, if nothing untoward is found, then someone could consider a pelvic floor dysfunction earlier. But in a lot of cases, there's other dysfunctions to be found as well. So that's why it's usually recommended, like, get some help, get an assessment first. And then, if things are not really resolving as you'd expect, then that's when you would consider something to do with the pelvic floor.
Many women, I think they feel kind of, as we talked a little bit about earlier, embarrassed, maybe a little bit hesitant to seek help for pelvic floor issues that they're experiencing, or I think for the majority, don't even know that pelvic health physiotherapy exists. What would you say to someone who's really nervous about seeing a pelvic floor physiotherapist for the first time?
Any of the symptoms that could possibly be bringing someone in to get the help of a pelvic floor physiotherapist is nothing they have not heard before. So there's no reason to be embarrassed. The physiotherapist should set up a space in which you feel comfortable and heard, and you have the ability to express, as much as you want to in a really safe manner. So it is up to the physiotherapist to create that space and make sure it's a space where everyone feels comfortable. In addition to that, like everything is meant to be really explained. So after chatting about symptoms, there's variations of an assessment that can be done. So the physiotherapist will work with each individual to figure out what they're comfortable with and work within that comfort zone to do an assessment and then figure out the optimal treatment. So yeah, the thing that I often hear from patients who are a little bit nervous and they don't necessarily know what to expect. Once I explain everything and they're comfortable to proceed, at the end of it, I always ask, like, how did you find that? And like, by and large, if they were nervous, they always say, oh yeah, that wasn't as bad as I thought it would be.
Which is always good to hear.
Mhm.
So let's talk a little bit about some of the exercises or some of the treatments that someone may be sent home with after an appointment. And I know one of the ones that you hear a lot about are Kegels are the answer to everything. Do you want to unpack that a little bit? Is this actually true? And, should all women be doing Kegels?
Yeah, Kegels are a really common term when it comes to the pelvic floor muscles. And I think, Jen, you probably are smiling a bit because, you have an experience yourself and you probably have been educated yourself on kind of this area too. So essentially, a Kegel is a type of training for the pelvic floor muscles that's specifically focused on strengthening. So the problem becomes that not every woman actually requires strengthening for the pelvic floor muscles. And that's a common misconception. I think for the women that do know about the pelvic floor muscles roughly, and they can kind of equate, okay, I'm having bladder leakage, so it's probably related to my pelvic floor muscles. Automatically, by and large, most women believe that it's because they're having the symptoms because their muscles are weak. And that is actually not the case. In a lot of cases, symptoms of bladder leakage or bowel leakage or issues with sexual health are not necessarily because the muscles are truly weak, but rather because they're tight and tense. And in that situation, if you were to do Kegels that are focused on strengthening, it has a possibility to actually make symptoms worse. So, no, not everyone should be doing Kegels unless they are told to do so by someone who has done an assessment, so ideally a pelvic floor physiotherapist.
So it was an interesting point you just made around bladder leakage and again, sharing the stats around how common it is. So maybe let's talk a little bit around what might cause that in someone if it isn't necessary. So is tightness the only thing, or are there other factors that may contribute? I'm just trying to think about if someone's trying to be preventative, what are some considerations that they might want to think about?
There's lots of different factors. So things like diet can play a role. So there's lots of bladder irritants, coffee, for instance, that can increase someone's chances of experiencing bladder leakage. So that could be one of them. Certainly, yes, like the pelvic floor muscles often are impacted, but it may not necessarily be that they're weak. It could be that they're tight and tense. Even beyond that, it could be that they have excellent flexibility and they have excellent strength, but the timing of activation is not quite correct. So, for things like a cough or a sneeze, for instance, what should be happening normally is that before we actually cough or sneeze, there's some abdominal pressure that's created. And that abdominal pressure is supposed to trigger an automatic pelvic floor muscle contraction. So, and that contraction is supposed to then kink off the urethra like a garden hose and prevent us from having leakage with things like coughing or sneezing or laughing. So, it could be that there's a strength issue or not. It could be that there is an endurance issue where the muscles actually can't hold for the duration that they're meant to hold, the duration of the cough or a sneeze or a laugh. It could be that there's an issue with timing. So maybe, again, the muscles are not kicking in at just the right time to prevent leakage. There could be a vast array of pelvic floor muscle dysfunctions that are present. The key is to be able to have strong but flexible muscles. Weight can be one. So it's been shown in research that even changes in weight by 15 pounds can make a big difference in either starting symptoms or helping also alleviate them. So when we're thinking about postpartum in particular and also postmenopausal, that can be times where there's often a change in weight, usually a gain. So that can also play a role as well as just like lifestyle factors and weight too.
So when someone becomes pregnant, it's like this perfect storm because you're growing a human inside of you, body is changing and like adapting to that. So no wonder it is so common in women, like as their bodies are changing.
Yeah, absolutely. Like you can't avoid the waking. We want that. We want baby to grow. So naturally, there's going to be a little bit of a pressure imbalance where the pelvic muscles, they might have, there's more pressure on them over a period of 6 months. So absolutely, that's going to cause a change in them over time. And in terms of birth, um, for a vaginal birth in particular, even if there's no tearing present, which is not so common, the pelvic muscles stretch to 3 times their normal length to make room for baby's head. So just that amount of expansion on them can really change their function too.
Wow. Let's talk about that a little bit more. This is a huge change. Postpartum, are there certain considerations that a woman should make or like consider when she's healing from her body going through so many different things?
Yeah, I think Canadian Physical Activity Guidelines actually do recommend that all women postpartum be engaging in pelvic floor training. And the best way to go about that, if you want to be preventative, is to do something called awareness training. So, awareness training for the pelvic floor muscles is simply contracting the muscles in isolated ways. So, trying to contract the pelvic floor muscles without engaging like the bum or the abs or the thighs, and then ideally timing that with breath, and then right away relaxing fully and completely, and not just focusing on the contraction, but the full release as well, and then resting for at least 10 seconds before redoing that. That in itself, making that connection between the brain and the pelvic muscles, especially postpartum, when the muscles have been stretched to that length and potentially also torn through, can also be really helpful just to be preventative with symptoms. But the key is the isolation of the right muscles, not holding your breath and relaxing right away and focusing on that relaxation, not just the squeeze.
So not everyone has babies, but all women go through menopause at some point in time. Are there certain considerations that women should be thinking about, especially as they kind of get closer to that prime menopausal time?
Yeah, so in that kind of phase of life, bladder leakage is also not uncommon. And it's not necessarily that hormonal changes in themselves, like a drop in estrogen or in a cause leakage by itself, because there's lots of women who are postmenopausal who don't have bladder leakage. So it's not that there's a cause and effect between going through menopause and having bladder leakage, but it is still really common. And usually the case is that there's a kind of a combination. You have these hormonal changes, and on top of that, maybe you had a weak pelvic floor to begin with, even if you didn't have kids, which is also very common. So in that way, things like awareness training and kind of connecting with the pelvic floor muscles are still really relevant. Also, things like tissue health. So again, as we age, because we have a change in our hormones, the vulvar tissues, the tissues around the vagina are not necessarily as supple or healthy because they have that lack of estrogen in them. So even considering things like personal moisturizers with or without hormones can be also super helpful to think about too.
Do you think that all women should see a pelvic health physiotherapist at some point in their lives?
In an ideal world, absolutely. I think that you don't necessarily know if you have a dysfunction or you have something, there without seeing a pelvic floor physiotherapist who can actually go through a comprehensive assessment with you and find if there are any deficits that you may need to work on. And nowadays, I actually am seeing women that are coming more so just to be proactive. They don't have any symptoms, but they want to see if they can just optimize their pelvic floor health for a number of different reasons. And by like more often than not, I rarely ever do an assessment where I say, like, everything's perfect. You don't need to do anything. Your pelvic floor is like as strong as it could be. Your endurance is a 10 out of 10. There's usually more often than not, there is a little bit of something to work on. So I think to be aware of that, and again, a woman by herself doesn't know, like, are my muscles weak? Are they not weak? Most women don't even know if their muscles are kind of on the type 10 side. So that's where actually seeing a healthcare provider who has that experience, so a pelvic floor physiotherapist, to do a comprehensive assessment can be really valuable in identifying any potential dysfunctions before symptoms arise.
I think that's amazing that people are starting to seek and like have before a problem actually exists to maybe get on top of that. What are some of the advice that you may give people if they visit, like if they come into your office and say, I don't have an issue, but I want to get on top of any potential issues?
I'll typically guide them. Like it really just depends on their assessment results and like what we find when we do that. So generally, we like I would do a very comprehensive assessment on the whole body, not just the pelvis and the pelvic floor muscles, and we'll identify any dysfunctions. A lot of times, they are also complaining of things like back pain and like, oh, I've had that for years, and if there's something that I can kind of do to address that, then I will. And typically, I would put them on some sort of pelvic floor muscle training program. Again, it's dependent on what they would require. If they need strength training or endurance training or more timing of activation or more flexibility relaxation training, it's very much individualized to every woman. So it's not necessarily like one specific thing that I say to everyone because it really just depends on what we find when we do an assessment.
Yeah, that makes sense. It's not like a one size fits all, but
No.
yeah.
And it's hard too, because even like for symptoms, again, like it's hard to say what's actually driving the symptoms if we are just talking about pelvic floor, which is obviously the focus of today, because everyone is so unique. I could have two women coming in the same day and have the exact same symptoms in terms of, let's say, rushing to the bathroom when they feel an urge to pee. And when I do my assessment with the pelvic floor, I would find totally opposite things. So yeah, really hard to kind of generalize. And that's why it's
Yeah.
it's so important to see someone because there's no like one answer that will cover everything.
Right. Well, I know two people are alike, so that makes sense
Yes.
why it would be very
Yes,
individualized.
absolutely.
So, unlike some healthcare practitioners, when you go in to try to address a problem, a physiotherapist will spend an incredible amount of time on the assessment and really digging in, to your point, the whole body and not just zoning in on what the area they maybe came
Mhm.
in with for the issue. What can
Yes.
someone expect, kind of like at a high level, from an assessment when they come and visit a pelvic health physiotherapist?
So very generally, there is like usually a little bit of forms to fill out ahead of time. So your physio can kind of get to know you and know your medical history a little bit ahead of time. And then during the actual appointment, a lot of it is chatting. So being able to get a really good idea of what symptoms you're experiencing, what are more bothersome for you. A lot of those symptoms that we talked about earlier, like the bladder health, bladder leakage, and sexual health, there's overlap between the two. So we tend to ask a lot of questions just to make sure that we are like very comprehensive in understanding what symptoms like a woman is currently experiencing. Even if it's not necessarily the primary symptom, they can often be related. So that's kind of important for us to know. And then after that, the physiotherapist should have an idea of like what to do for a physical exam. So typically, I'll speak for myself. Usually, it includes some sort of postural exam with someone staying totally dressed. So we'll have someone in standing doing some general movements so I can assess back mobility, looking at things like alignment, looking at hip mobility, looking at the abdomen. So to see if there's something called diastasis recti there, looking at abdominal strength, taking a feel of the spine, including the tailbone. So that's all the stuff that's done dressed potentially, just to get a whole sense of the whole body. And that will also be tapered depending on someone's symptoms. If they're having leakage specifically with running, well, then maybe I would do a couple things a little bit differently to kind of be a little bit more dynamic with my assessment. So that's kind of a bunch of things that could be done dressed. And then also typically includes some sort of pelvic floor exam, and the most accurate way to do that is with an undressed internal exam. So the physiotherapist would explain everything to a patient. And if that's something that they're comfortable to go ahead with, then that would be the another part. And if not, there's other alternatives as well. But that by far is the most accurate way to assess the pelvic floor muscles.
I love that again, and I think this is the power of physiotherapy in general, is just really taking the time to understand the person as a whole, all the different body systems, because we know they all interact together. And
Yeah.
sometimes when you have an issue in one area, it might be connected to something completely different that you had no idea about.
Absolutely. And it's up to the physiotherapist to kind of make those connections and do it. That's as you say, that's why we do such a comprehensive assessment so we can make those connections and give our patients the best chance of like having a successful quick recovery to be able to kind of put everything together.
How young should someone be thinking about their pelvic health or worrying about certain symptoms?
It can be very young, even in childhood. So there's a couple other symptoms that are actually really common, and this is good you brought it up because we didn't touch upon this one yet. Even chronic constipation. So constipation is actually really common at any stage in life, but also as a child. And it's one of the main reasons for referral for to a GI specialist in children is because they're constipated. And that in itself can actually lead to quite a few other issues in terms of abdominal pain, bloating. It also can predispose that particular child to having bladder leakage too. So there's often a connection there. And then even something like bedwetting, that's also really common too. That's one thing that it does improve naturally as a child ages, but regardless, that's something that is often really embarrassing and it can really affect a child's like ability to form these social connections, sleepovers, that kind of thing. So even seeing a pelvic floor physiotherapist, if a child is having issues with bedwetting, is also a really common reason for referral. Even the other things that we already touched upon, so bladder leakage with coughing or sneezing or jumping on a trampoline, you can also, have that as a child too, even not necessarily having gone through hormonal changes of getting a period or postpartum or menopausal. That can also still happen in childhood as well.
Something to always be aware of if, you notice something within your child that doesn't seem quite right.
Absolutely.
If a child comes in to see a pelvic health physiotherapist, what are some of the prescriptions or treatments that are recommended?
So, similar to adults, it tends to be very much like all-encompassing and multifactorial. So, for instance, things like water intake can be really relevant to go over and to figure out kind of optimal water intake for a child. A lot of times there is concurrent constipation complaints. So, addressing that in a lot of cases can actually help with the other symptom if it was bladder leakage, for instance. Things like vitamins. Actually, it's been shown that vitamin D can actually change or improve symptoms in kids of bladder leakage too, of the bedwetting in particular. So things like that we can often educate on. Also, a version of pelvic floor muscle training can be indicated too, especially if a child is having like daytime issues too, not just nighttime issues with bedwetting. And that one, we tend to have a little bit of a different approach to it. You can still do pelvic floor training and going back a step to do a pelvic floor muscle assessment very generally from the outside with someone staying dressed, just feeling at the tailbone. So I often adopt that approach for kids just because it's not very invasive. They get to stay dressed, it's very comfortable, and we can still kind of address the pelvic floor in a very general manner.
Mm-hmm.
A lot of times, too, it's a lot of education on the parent. So just to kind of educate them to adopt like a non-blame approach, to educate them about the physiology of why this is happening. There's also something like some devices that you can purchase that actually go underneath the sheet, like bed sheets. They're kind of like an alarm that is activated by moisture. So a lot of times, like for bedwetting, for instance, integrating something like that can be really helpful too, because the child will actually wake up when they start to be able to like be like, okay, I need to go to the bathroom. Things like similarly, like other contributing factors, weight. If there's any kind of weight gain, addressing that too can be super helpful. There's also been shown there's a connection between like sleep apnea and having bedwetting issues too, or ADHD. There's a connection there between that and also having bedwetting complaints too. So just kind of looking more kind of well-rounded at the whole system and the whole body and the whole person can be super helpful even with that age group. Even like rewards, doing like stars on a calendar and like having that be the reward for like having a dry night. Like once they adopt some of these systems can be super helpful with that age group.
I'm just thinking about youth, and again, I don't know if this is something widely talked about or that a lot of parents know to pay attention to. If left untreated, Could this lead to further complications in those children down the road as they grow up into adults?
Yeah, so if we just kind of touch upon those two main things again, like the chronic constipation and the bedwetting. So for chronic constipation, most commonly, like hopefully someone was consulted, and oftentimes that would be a family doctor. A lot of times the treatment is medications. So whether it's like a variety of laxatives or other things. And it's been shown in research that although that could have short-term value, actually that's for long-term control of symptoms for constipation in particular, it doesn't really have as much value. The symptoms tend to return, not be as well managed. So in that case, the symptoms can certainly continue for someone's lifetime. And I've heard that a lot from adults. We ask about bowel symptoms. Again, that's not necessarily what they're coming in for. And they say, oh, yeah, I've had constipation, but I've had that my whole life. So it can actually contribute to other complaints later on in life with bladder or bowels or issues with pelvic organs in terms of feelings of heaviness or bulging. It all can contribute to that too. And then in terms of bedwetting, again, the positive thing about bedwetting is that as someone ages, the symptoms do tend to resolve even without any treatment. A physiotherapist can help speed that process along. But, as someone gets older, naturally, usually the symptoms do actually get much better. But it's also been shown that if a child has those symptoms when they're younger, even if they totally resolve, their chances of developing any of those symptoms, bladder or bowel related, as an adult, increases significantly.
You've touched on so much, and I think there's so many valuable takeaways for women to consider when it comes to their pelvic health. But if there was one thing you wish more women knew about when it came to pelvic health, what would you say would be that?
Be mindful of it. I think as a society, we have gotten better about understanding that keeping our body in good condition, diet and exercise is an important part of healthy aging and healthy living. And I would just love for all women to understand that as part of that healthy body, the pelvic floor muscles are a really integral component that we also need to kind of think about, especially as women.
Thank you so much, Nadia, for coming on to the show. I think this was very educational and very insightful. I know personally I learned a little bit more today, and I do feel this is a really important topic that we need to talk about more when it comes to women's health, and women shouldn't be embarrassed about bringing these up when these symptoms are happening.
Absolutely. I'm happy if there's even just a bit more awareness about it, and I'll be very happy.
Thanks so much for joining us today. We had a great conversation with Nadia around pelvic health. If you're interested in learning more about physiotherapy or to find a physiotherapist near you, visit albertaphysio.com. See you next time.